it's a late start day, so I have surgery meeting in the morning. I have a 15 bilateral surgeries. So this is the first one. This is the right first eye of patient number 1. Very thin cornea, 460, so make sure your wound is long enough. Otherwise you can have a wound that's not well self-sealing. So always look at the corneal thickness before you start. A little bit of pressure, my dear. This is the freezing. It bites a little bit, that one. That's normal. Yeah. That's good. You're doing great here.
I didn't look at the other table yet, but I doubt it. Do you want regular?
No, I don't think you do. That's why
Dr. Youssef, but I did make some treats that are in the lounge if you had
Oh, okay, thank you.
all good.
That's don't usually eat during the day.
But they are
But
big eaters around here, so if
I
you
know.
don't get there early, I can't guarantee there'll be anything
Are you
left.
trying to slow me down? Come on. That's your trick for today?
That's my
Yeah? Okay. Yeah, okay. So I'm gonna send someone for to get it. How is that?
Yeah.
I'm just kidding. But thank you. Thank you. So what kind of treat did you get?
I made oatmeal chocolate chip cookies and I made some Rice Krispie squares.
Okay, that's both are sounds delicious.
Nothing fancy.
That's fancy enough.
My mom's having a scope today, so
Ah, okay.
people that have to tolerate her.
A very nice trick.
Usually it's me.
Now it's everybody.
Now it's everybody.
Doing great, my dear. Everything is going well. You come with the light. You're an excellent patient. Keep it up. EFX is 0.4.
Yeah, I think Heather got it.
I got it? Okay. That's good.
I heard her say it when I wrote
Yeah,
there,
okay. No, that's good. That's the lens going in, my dear. You're almost done here. Doing great. See, the cornea is thin, but the wound was okay because we realized the wound cornea is thin. The cornea is 460. So if you just do your regular angulation, you end up with a very short wound. That's one of the reasons why you should be checking the corneal thickness of every patient. There are very long or very short ones. It's probably we're all done for this one. One down, one to go. Okay. So this is the left second eye patient number 1. Again, very thin cornea, 460. Angulation has to be taken into consideration. You get it into, okay, so point more to the apex of the cornea. Look at the light. I'm getting too long, so I shortened it out. A bit of pressure. This is the freezing. Do the same thing in the second incision.
So we're going to Legion for Fish Fry morning. Yeah. And she had told me they have country music there every Friday after the fish fry, like from 6 till after the fish fry, 6 to 10 or something like that. Anyways, so when I texted her, I said, like, are we just going for dinner or are you expecting to stay for the music? Well, it would be nice to stay. We go going to. Yeah, exactly. David and his wife and my brother Danny, his wife's away. It was just Danny alone. And then me, Scott says he's coming. I have my doubts that he'll get his shit together to go. Austin's supposed to come and my Uncle Reggie. So who do you think is going to have to drive her home after country music? Because the boys don't live in town. They're not going to stick around. It sounds that way for sure. Which I don't mind sitting at the Legion listening to country music with my friends because I'm also drinking. But if I'm driving the old girl, it look bad if we get pulled over for a beard or something on the way home. It'll look bad. Yeah. 0.6. So I have to go pick up the cupcake bouquet tonight. Yeah, like I've got a doctor's appointment like at 2:40, so I gotta be out of here. And then I have to go. These are like between Nuremberg and Bloomington. I gotta go pick those up. Then I got after and doctor. Yeah, like at for 6:30. So I was like, yeah, okay. So anyway, I'll come home quickly, have a bite to eat, go out there. I might stop at Austin. I might. I know. And then,
This is the lens going in, my dear. Doing great.
toaster oven air fryer. So I got it. It's time to measure it. I have to pick it up and just play with it. The one that I used to play cards with. So I'm sure I'll be there for like at least half an hour picking it up. Because I do like to gamble. So chances are I won't get home till like 9 o'clock. Yeah. Dave's tomorrow, and then we've got to go fish fry at 4 o'clock. Because you got to get a seat if you're going to stay for the country music, apparently. Who knew it was a thing?
Okay, that's good.
She goes like every 2 weeks for her meal time, so I've got a thing for the meal plate for her, for her hands and her feet. Because at this point, what else do you get? You know, like, and she doesn't go to her same hair person.
And all done. Both eyes went great. Excellent. Okay. Okay, so this is the left first eye of patient number 2. Cornea of 570. So it's probably regular angulation. Okay, so see regular angulation, so it results in good wound depth. Okay, you can feel a bit of pressure now. This is the freezing, it bites a bit, that one. Just bear with me, you're doing great. Good. Hope you're enjoying the nice color show. Nice colors, huh? There we go. That's perfect. Everything's going really well.
Remind me, I'll pick you up in the morning. No, it's 5 minutes.
EFX is 0.3.
I had my beach shirt on the other day when Richard was sitting out there waiting for you. Yeah, well, I said, you like my shirt? What? He watched the game. Did he? Yeah. Well, but he didn't cheer for us. He watched him, yeah, I think he probably is cheering. Secretly, just because it's a Canadian team. Yeah, exactly. Yeah, all in secret. Yeah.
Dr. Youssef,
Uh-huh.
those masks,
Uh-huh.
enjoy them.
Huh.
They're that's it.
Okay, we need to order another one.
Nope. I spoke to Andrea. She said there used to be tags, and as you know, there was no tag put on that wall.
Okay, we have a box, so I have a while before I run out, but we need to order another one.
They don't make them anymore.
Okay, probably the company makes something similar.
So I don't know.
Okay.
I'm leaving it to you.
Who's running this part? Who's ordering?
That's stores.
The stores. Okay. Yeah. Okay. And we were talking about the one anti-fogging mask with a little plastic strip close to the nose, so it prevents fogging of the microscope. That's my favorite, and I love them. Okay.
Sorry.
Did someone call in sick today? Not here.
Yeah.
Not here.
And we're all done for this buddy, so that's good. One down, one to go. Change everything. So this is the right second eye, patient number 2. And a thick cornea, or slightly thicker than normal. So 585.
See later if it's up.
But the pressure, this is freezing.
HR sometimes will take a month to post it though,
Okay.
so I'm not any further ahead. Maybe. I'll apply. I might as well. I'm here all the time anyway. Well, that way I'll get, well, I don't really need, I'm gonna keep the benefits the way I have them. All good? Oh, thanks, Nat.
So you're not taking the benefits?
I don't think so, because like I had to jump through some hoops to get it
Right.
before.
Yeah.
So if I go full time, decide in 2 years I want to be done, then I got to go jump through all those hoops again to get my insurance in place again.
Yeah.
You know what I mean?
Yeah.
So I think it's probably just as easy to stay where I am.
But could you take them, get some stuff done, and then?
Well, I have manualized
You have
now.
good enough that.
Well, it's good enough for what I need. You know what I mean? Like I don't want to I don't want to have to do all that again in a couple years or 5 years or however long I plan to stay. Or
could you keep both?
it's not worth my while to keep both because you have to pay for your share here. So I'm not going to pay twice. I'm not going to pay for my own and then pay for my half of here. It's almost the same price.
But you wouldn't contribute to the pension.
I can't. Once you've passed out of hoops, you can't get back in. It's like the Mossy life. Once you're out, that's it. You're out.
So what would be the benefit of
Vacation. I can bank my overtime. I can't bank anything now. And sick time. Not that I'm sick very often.
No.
But at some point, my knee's going to conk out. I need something done. So at least if I do need something done to my knee, it can be on their dime and not mine. You know what I mean? Yeah. Maybe. I was looking at getting one in the fall anyway. But I don't know. I gotta take my little car. Somebody hit me in the parking lot here about a month ago or so. So I've gotta take my car next week to get it done up. So I just may like it so much once it's all pretty that I may just keep it.
can look at the light, friend. There you go. That's better.
No,
Thank
probably
you.
have a rental next week. My car's going to get where that lady hit me.
Oh, okay.
I have to drop it off Monday to get fixed. But I don't know. I have to go by J&A. I don't know if I'll have time to go by there today and find out because I have to work at 7:30 on. Maybe I should switch and do 9 to 5 Monday. And that because I think they open at 8.
Yeah, I think you can drop it off.
Don't be switching on Friday. Sorry, switch your rooms. Well, yeah, no, but because I have to drop it off like. They only open at 8, and then they arrange your enterprise rental and stuff. So it's going to take at least half an hour for somebody to pick me up.
Yeah, but if you drop it off, there's probably a box, right? Get it drive to work.
Yeah, but my enterprise, I won't have a car, which is fine. I can walk from there to here on Monday.
Oh, I'm on the floor, I hope you got.
No, it's all good. But I just wanted to stop there and see, like, is it better to drop it off Saturday? And whatever, but I have places to be on. I'm golfing in the morning, and then I've got that curling banquet Friday or Saturday night, which I'm hoping not to drive to because I probably shouldn't drive home after that.
Yeah. Who are you going with?
Sue and Amy and Terry and Nikki. Oh, she will. Well, I think she will. I think Curly's going to drive. Yeah.
And we're all done. That's it. Both eyes went great. Okay, so this is the right first eye patient number 4 on my list. Some extra freezing, my dear. I'm just gonna drag it a little closer. Here we go. That's good. So you can feel a bit of a bite to it, my dear. Just bear with me. Here it comes. That's the one. There you go. Doing really well. Everything's going great here. Okay. Bit of pressure. That's normal. Okay. That looks good. Excellent. It's going really well.
Oh, I've been told jam.
It's not now. It's inactive.
Oh, okay.
It says inactive. Probably
So I'm
hit
good
the
to go?
yeah, good
Alright.
to go. Yeah. When it's gray, it's inactive. It's done. EFX is 0.8. 0.8, yes.
Pretty quick 0.8.
Take your time, there's no rush.
No rush. No rush. Famous last word.
I don't mean anything of it. I'm just saying that as a compliment. Yeah, that's it.
Yeah. Is it okay?
Yep. And we're all done for this one. So we're going to change everything, get ready for the second one. Great. So this is the left second of my patient number 4 on my list. Okay, you can keep looking at the light. You're doing great. Nice average cornea. Maybe some extra freezing, my dear. Is going to that one. Just keep looking at the light. Look at the light. There you go. That's your only job today. Look at that light. There we go. Good.
.5 Mario. 2.5.
This is the left eye.
This is the left eye.
Look at the light. There you go.
That window door. Oh, that's good. Everything must have been okay.
Especially after that silly,
Wow, that ischemic colitis business that she had. An Ottawa sculptor, and no one ever contacted us with the results.
Look at the
Got
light.
readmitted here, and they usually had to look, like, it was hard for him to find the results of those biopsies.
already told her she had, maybe I already told her she had something. I thought he did with great books.
Who knew? Well, he was worried she had a bleeding tumor. Because she kept bleeding and bleeding and bleeding. She got transfused to the unit. She was between those in the stay like bleeding.
Well, they told her there was something, didn't they? When the doctor told her something or whatever, they biopsy.
They biopsied. Oh yeah, it was the residents that didn't know the cecum from the sigmoid that I talked to on the phone, and I was like, well, where did you biopsy? Oh, you know, the cecum and the this and the that, and I thought, you don't know anything, fella.
Bit of pressure.
Don't put your pen in there.
And you're all done. So great. There we go. Well done. This is the left first eye patient number 4 on my list. If you look at the light, it has a very shallow chamber. See the peripheral iridotomy that was done previously. A small to medium sized pupil. Very thin cornea. So make sure your wound is long enough. And if you give you a little bit of freezing, this will bite a little. We'll see if we can dilate the pupil a little bit more. Nothing. That. Okay. Okay, I'm not sure if that's big enough for that. Let's see the size. Okay. Now you can open Mally. You can read, please. Okay, thank you. Yes, I just put it there. Okay. So engage the nasal, tilt down. As my hand is tilting down. To engage the 2 scrolls. Okay. And do the sub-incisional one, it's the more difficult one. And then finally do the one that's missed the mark. Okay. And after that, I'll inject more viscoelastic on top of the. Don't want it to be jumping around, so press on it, and put some in the middle too. And here I don't mark the cornea because the malignant is the mark.
She was grinding last night. And she was sleepy like during the hockey game. But then I went to bed and she knocked over some stuff on my dresser in the middle of the night, and like she's, yeah, I don't know what the solution is besides sedating her. For both of us. Well, and I don't want to take anything to help me sleep through the week, because like I gotta be alert when I wake up. But I was thinking about it. But by the time you're thinking about it, it's too late. You have to give yourself like ample time for it to wear off, you know?
The lens itself seems to be a big one. As the lens power is 26, so has primary angle closure. The shaper tip just hardly fits in the chamber. So these cases, try not to wait until the cataract is very well developed. Try to do it early. Don't make it difficult for yourself by waiting too far. This is a +2 nuclear cataract. So it's softer, easier to remove with this small pupil shallow chamber. That's good. EFX is 0.8.
0.8?
Yep.
Not very much.
Yes, it
Not any
isn't.
much time over here.
You can take your time, it's okay. I'm good till the end. Yeah. I know how to switch the IA, so don't worry about it. So for small pupils, you range always when you do the J cannula, you have to keep an eye on the wound to avoid iris prolapse. Always put one of the scrolls underneath the wound incision here, so that you don't have the prolapse. And I almost always use the Nadium ring rather than the iris hooks. So there's a +26.
Lord, man.
And that's why I prefer the ring over the iris hooks.
Yeah, for sure.
Yeah.
I mean, it's all what you're
You used to, yeah.
You know, like
yeah.
Seuss was.
Yeah,
super
Seuss
fast
was with the hooks,
those.
yeah.
But then
It still
the
takes
other
time.
guy,
You have an extra 4
who
or
was
5
the oth-
incision.
Who was the other guy?
Dr. Shuley or Dr.
Shuley.
Yeah.
It would take him 10 minutes to put them in.
Yeah.
You know what I mean? Like,
Yeah,
it's just
okay.
what your
Yes.
weapon of choice,
yeah.
you know?
Yeah. I prefer Egan ring over the hooks because it's
Yeah, it's all
no
with-
extra incisions
Yeah.
and it's
Yeah,
really
yeah,
quick.
yeah, yeah.
Yeah.
There's no tea for nursery this year.
I brought some today.
No, not you. You know what? There's no food next week.
What's happening next week?
They're watching out for our health.
Uh-huh.
What is there?
Nurses Week? I don't know if it's anything.
Monday, appreciation packages from the manager, trivia, and wellness cart will be rolling.
Okay.
Tuesday, the packages continue. There's some trivia and the wellness cart. Wednesday, skills fair is main entrance with prizes. Appreciation packages.
Okay, all done for this one. So this is the right second eye of patient number 3 on my list. Also very shallow chamber, preferredectomy, small one here, small pupil, corneal score, and very thin cornea. Make sure your incision is really long. Okay. Give you some extra freezing. This will bite. There it comes. That's the one.
It's 0.8, I think.
It's 0.8, yes. So can go to Maligan ring.
You open me that ring? Yeah, they're stiff.
Ring. Engage the nasal. Tilt down so I try to engage the other ones. Sometimes they don't. Here, it's an issue. What you would do, you would engage the sub-incisional one, which is the most difficult one. And I usually do superior, then inferior. And fill with endocoats on top of the Maligan so it doesn't jump around. And in center to enhance the braces. I'm going to mark the cornea. This is already marked. So there's a little scar nasally in the corner. They probably had the previous region removal. You can see the scarring here and the scar here. I wish they had different colors. Yeah, that's a good idea. Yeah. So.
I try to line them up in the
Yeah,
order
that's
that
good.
suits them, but
That's good.
if I'm setting up like another table
Yeah,
down
yeah. It's okay. Yeah. I wish there were different colors for these.
yeah, it'd be good.
Yeah,
Or if
yeah.
they put a little tape on one
Yeah,
of them.
they don't allow us to do taping anymore. So yeah. So it's a +2 cataract. You see, it's already a difficult case without having a advanced cataract. So it's a good idea to do these early, not late, please. So multiple problems, small pupil, corneal scar, shallow chamber. So don't add to that a huge cataract. Cataract gets thicker as time passes too, so you make the chambers shallower and shallower. So don't wait for that to happen.
.6. I was teasing Dave last week when I said I'm going to switch her to the morning, so you'll have to pick her up. I was teasing him. I said, "You're just going to go and shampoo your truck when you're done." In case there's any biohazard in there after. Nice. Yeah, he didn't think I was that funny. It's funny, like when we're all, like the two boys and I are together, like even when their wives are there, like the three of us are laughing like hell at all sorts of stuff, and the wives don't get it. Like they're looking at us like it's not that funny.
It's called inside jokes.
Yeah. I guess you had to grow up in our house.
Yeah,
to get
exactly.
some of it, you know?
Yeah. A lot of it, we think it's funny for everybody, but
Yeah.
it's not. It's just your person.
my dad was like that. Like he could find humor in almost anything, but not always appropriate humor. Like, and the three of us are the same. Like we're, you know, the stuff we find funny, like people think we're weird. But that's okay. There's other reasons they could find me weird, so that's one of them. Yeah, that's not so bad.
All done? Okay, that's good, thank you. Look at the light. This is the right first eye of patient number 5. Okay. Use some extra freezing. This will bite a little bit. Here it comes. This is the freezing. Okay, that's a bit better, but that still gets high a little.
Not with him, with my brother. He's like, well, I'm going to take all the stuff out of the store and get it cleaned up for you. I said, no, like, I'm a big girl. If I'm on golf, I'll look after my own stuff. Oh, no. You went in there, and then, oh, you put it away dirty last year. I said, I'm going to get it. I'm pretty sure I cleaned it last year, but maybe not to his specs. So then he's like, is it okay if I have like a spare small bag? Like my old bag had a hole in it, so I actually took something home from here with me.
This is myopic. Its chamber is deep. The lens power is plus 12
He says,
DRU.
well, I'm going to take the spare bag. And he says, I'm going to separate some of my cups. Because he's got extra cups for some reason. Okay. And he says, I'll make a set for Austin. And I said, Austin can golf. He doesn't like golfing. He'll go to the driving range if I twist his arm. But I said, he's not interested in golfing. Oh, I think he'd go with you if you asked him.
So what we'll do, try to split the lens inside the bag and move the pieces into the chamber. We have a deep chamber. It's a very deep chamber. There you go. So first piece of the most difficult. Once you get it into the chamber, very good. Don't let the epinucleus come back early. I'll push it back again. Okay. And get it in the chamber. Get to a comfortable depth. Push it into the epinucleus back. Let the epinucleus keep the capsule open and protected till the end. And then this is the last piece. This is the most dangerous. So I'm gonna remove the epinucleus now. So Jake Haniel with deep chambers like that. you control the depth by controlling the wound. Okay. So there you go. Go inside, let it in. Make sure you're inside the bag. Okay. Okay, here you go. It's a little floppy iris. Okay, that's good.
2.0.
Okay. Chamber. So this is DI boost plus 12. See, there's no opening here. So I remove this, push that part in, and you have an opening now. Okay.
I think I need some chicken soup.
I'll give you some more.
More chicken soup?
Yeah.
Yeah.
In a minute. We're almost done here, so. Yeah. Yeah, I'll give you some more. You're doing great, by the way. We've done this one. Yeah.
What's all these specs I see? It's like,
You have a lot of stuff happening now. There's a lot of things happening, so everything is good here. Yeah. Lens is done. Everything is done here, so I'm gonna just close down. We're all done for this one. I'm gonna change everything, get ready for the second one. Do some more chicken soup. Okay. So this is the left second eye, patient number 5. Okay, keep looking at the light. That's the cornea. Okay. Look at the light. A little bit of pressure now. This is the freezing body. This is normal. It bites a little. Yeah, that's good. Look at the lights.
Keep your hands down. Sorry. Won't be long.
okay.
Look at the lights.
It was a quiet one. Yeah, it was.
So So it's very deep chamber, it's highly myopic. So we divide the nucleus inside the bag, move the pieces to the tear chamber. We have also some floppy iris. Push back the epinucleus, not time.
No.
Now the all nucleus is gone. I'm gonna go to the epinucleus. Now the chopper is underneath the tip. Okay, that's good.
1.9.
So there's some IFS, so be careful with the subincisional. Look at the light, keep looking at the light. Okay.
Like 1100 instead of 3500. Crazy, especially in USD. Yeah. We're going for the tasting.
Look at the light.
You used to get nice ones at Sears for the kids when they were little.
Bless you. Is the lens going in, buddy? You're almost done here.
Not dressy? I don't know. I never went here.
Oh yeah.
You can see the IFS. Look at the light. I'm almost done here. So always have this blind sweeping of the anterior chamber, especially the subparacentesis. Okay. Okay. Look at the light.
Moors will sometimes have a shirt and tie included with their suit for about $200.
And
What do we don't have a tip top here.
Classes have $2.99, but that's a $40 shirt and a $30 tie allowance.
And we're all done for this one. You did great. Okay. So this is the left and first eye of patient number 6. Okay. And then we have a nurse here. I'm going to be explaining the steps to her. Okay, so keep looking at the light. So we'll start. This is a fixation ring. I try to. This is a very gentle way to fixate the eye. I go in with a self-sealing pattern. So the wound has to be about 2 millimeters to be self-sealing, and the angulation is appropriate to the corneal thickness. Okay, so you can see the wound is this size here. I'll give you some extra freezing. This will bite a little bit. So this is the preservative-free xylocaine, 1%, with phenylphthalein 10%. So this is the freezing. So we used to put these kind of mixes on the infusion, but we don't do that anymore. Just give them the incision this way. Okay. And this is the Indocode, the thicker one of the two viscoelastic we use. This will inflate the eye, and I'll cover the cornea with it so you don't have to keep squirting the cornea throughout the surgery. Nice colors, huh? Okay. And now we do what we call second incision. So the first one was 2.7, and this is 0.9. So we don't go all the way, just partial. So to allow just the chopper to go in. This is a corneal marker. So this is the second ring we use to mark the cornea. I want to make sure that my capsule rectus, which is this strap, is the appropriate size to cover the lens. So this is the way we make sure of it. We open the capsule of the lens in the center and just drag it, and then go around following the guide of that mark on the cornea. And the idea is that one full coverage of the lens, so that decrease the possibilities of what we call PCO, and improve centration and make the results more reliable and stable. Now I'm going to go with this is the BSS, this is the 10C syringe. I'm going to split the layers of the lens from the capsule, and this is called hydrodissection. So this will allow the lens, you can see it, I can rotate it now. And then I'm going to do a hydrodelineation, which is splitting the nucleus from what you call epinucleus. And this will allow me to remove the harder inner part and leave the softer outer part to protect the capsule. So now the phaco is a vibrating tool, so the tip will vibrate at 40,000 times a second, and will break up the cataract. There's infusion coming from the side, and the tip is also hollow and allows the all the fluid to come out of the eye from inside. Okay, so I impale the nucleus, and with the chopper I just divide. So we use the minimal amount of phaco that way. So minimal amount. So I try to make it as least as possible. So we divided the nucleus to half then quadrant, and then I remove the quadrants at the pupil level in the center, not inside the back, to protect the capsule. I want to keep that capsule protected. Okay. Rotate again, so we half is gone. Now the second half. So the capsule is the king. You have to protect it at all costs. So that's why I leave the epinucleus there. I use the chopper to protect the capsule, because that's what will hold the lens in place, and that's what protecting the back of the eye, the vitreous, from coming forward. So and now epinucleus, so the nucleus is gone. This is the epinucleus, softer outer part. You can see I'm not using any phaco. I'm just using irrigation, aspiration. So this okay, just sometimes it's just a little. So now this is the nucleus and epinucleus are gone.
1.2.
Now to the J cannula, and this is the most important thing. That cup has to be very tight.
Okay.
If you don't, it's going to be like a bullet, because I use a lot of pressure on it. Okay? So see, this will irrigate fluid backwards toward the wound. So that's what's happening here. So you can see the cortical material is moving outwards. You don't see it. It's really moves really quick. You hardly see it when it's going out. So this way, I'm not doing any aspiration at this stage. I'm just using irrigation, and irrigation is safer than aspiration. Aspiration, when you aspirate, you can aspirate the capsule too. So that's why I use this method. Okay, so now the capsule is clean. I'm going to inflate the capsule with the second viscoelastic, and this is the little easier one to remove. So the first viscoelastic is called dispersive. This is cohesive, so that when you move part of it, all of it comes out. Now the lens goes in folded, and this is a preloaded lens. This is DI blue, and go in, closed, and the legs or the haptics are within the optic and protected. So it goes in. I'll put it inside the bag. That has to be inside the bag, no other place, and it will open inside. Now I'm going to use that lens to protect the capsule while I'm doing the irrigation aspiration. So now I'm going to do some aspiration. It's removing all the whatever left over, okay? But I'm using that lens as a shield to protect the capsule, avoid the complications, okay? So I'm removing all the cortical material that's left behind. And now I'm removing all viscoelastic from the chamber. Okay. I position the lens usually horizontally. Now I just move the viscoelastic from the front of the cornea, and just doing some irrigation inside, so it's something hiding, it will come out. Okay, there we go. And now I'm gonna hydrate the wound with an antibiotic. So the hydration of the wounds is the one that will seal the wound. Give it an ample amount of antibiotic into the cornea, and it goes into the chamber. So this is what makes it safe to do both eyes at the same time.
Okay.
Yeah, because it's increase the infection rate to less than 1 in 10,000. Okay. Okay, and we're all set. That's done. Okay. So this is the right second eye of patient number 6. Okay. Use some extra freezing. This will bite a little. There we go. Here it comes. That's the one.
Come back more. I wanted a small one, but I ended up getting a big one. But is there anything to put my name on it? Oh, perfect for your trip. What's that? Perfect for your trip. Yeah, and it's really hard. I really needed probably, because we're going to Atlanta, but you need a 21-inch from the floor, and my carry-on is 5. So we just look through the bottom, like cheap. So this one was. And I got it, you could pick a color, so I picked blue, and it has Richard Gregor on it. And it lost. That's nice. Where'd you get that? The heart or the heart? What kind did it have?
I needed to get some luggage for when we go to Greece.
I can look with my sister-in-law that we were carrying on. It's got a new and it's all my house. She's right there. She's right there. Well, she gave us the good old everywhere and once we ran our shop. Oh, yeah, like little package things? Yeah, so we thought that was a really dangerous and we were going, we're not staying in those places, we're going like this. Where are you going? We're going to Scotland, we're going to Glasgow, Ireland, and then we're back to Scotland. So, yeah. But it's a tour, but it's a global tour, so we don't stay in one spot really long, so I don't want to let people in big cities with them and forget things. Yeah. So I think we'll keep going up and this is yeah. Not everything happens.
2.
sound on your camera now?
I don't know. I don't really know her, but I saw the name. The last week it was 248, which wasn't. That's right.
Okay, all done. Okay, so this is the right first eye of patient number 7.
Now, do I go, I know I go to your office.
Yeah.
Do I go to Walmart too?
After done all the follow-ups, so 6 weeks, you can go see the optometrist there to get new glasses.
Okay.
So, but I'll see you myself for the follow-ups.
Wait.
A bit of pressure.
Don't worry.
Yeah.
What do I wear in the meantime?
Pardon?
What would I wear?
Meanwhile, you don't need anything for distance usually. I just wear glasses for reading, and typically it's over the counter like +2 or +250 should be good temporarily to read with until you get your final prescription. But typically distance should be okay with no glasses. Yeah, it's not going to be perfect, but it's going to be okay.
Because I was pretty sure the form you gave me said go to Walmart after I left your office.
No, this is after you've done all the follow-ups in 6 weeks. No, not immediately. No.
Oh,
The first 6 weeks, I'm going to do that
Do you just want
myself.
to go shopping?
Keep looking at the light. There you go.
Is that what you're asking?
Yeah.
Keep looking at the light. Don't look around. Keep looking at the light.
It's asking if you go shopping at Walmart.
Yeah.
I don't think it was about glasses.
No, probably the optometrist is in the Walmart optometrist. She's asking about that. That's what I guess. Can go shopping if you want. That's fine. But the optometrist,
That's a good word.
yeah. It's, keep looking at the light, my dear. That's your only job today. Don't look at the light. That's the only job.
Well, I mean, I have all those drops at home
Yeah, you're gonna start them today for sure.
today.
Yes.
Yeah, Debbie, I think it's more the loss of
Look at the
the
light.
ability to go. Yeah.
Look at the light, my dear.
I just don't like him so much. Oh, I know, I feel that. Like, I understand your situation. You have to let him like that. But it's not even like, I'm not wrong. Like, the last time we were there, yeah, well, he's also, I didn't go. We went to March for the safety of it. And, we didn't go shopping. Well, we did go shopping, but like, often we go to the mall.
please.
But it's still doing, but I don't know whether, like, why does it have all of that power? You guys are changing what people are doing.
EFX 0.7.
But it's a sign of paper and then it's dropped it, you know? Oh, I know.
Give me a McPherson. See, it's
Oh,
hard.
yeah.
When you have that, there's something wrong. So. Okay.
It was okay to put it in.
Now the trading haptic is probably stuck. See what it does? See if I push it a little bit, it's gonna lose that lens. So,
Oh, yeah.
okay, so it should go in smooth. If it's not smooth, there's something wrong. Okay, chopper. So the front haptic is the one that was stuck. Okay, that's good. Okay. All done. This is the left and second eye of patient number 7. Okay. Give you a bit of pressure. Keep looking at the light. I'm going to give you some extra freezing because this will bite a little. That's the one. Yeah, that's the one. That's yeah. Just keep looking at the light.
Yeah.
Too long.
Oh, sorry.
No.
Lenses in one.
And all done. That's good. So this is the left first eye, patient number 8.
He likes to grab his own stuff so that you can hurry up and set up for the next table.
Okay.
Yeah, please don't hand me anything.
No?
Yeah.
Okay.
I have very long arms and I can't reach everything, so. There you go, so. Usually the stuff I use I put aside here, so it's less messy. Can I feel a bit of pressure? This is the freezing, that's the bites a little bit, that one.
No, it's not too dead. My other stuff.
Oh, that was the cue.
That was the cue.
Talking about.
She's well trained, I'll tell you.
Follow the cue really well.
So now he's going to be ready for this syringe, and I haven't got it ready for him. Almost.
Perfect timing.
There.
Wow.
So this has to do a tune, so it's priming and tuning, and you'll hear it kind of go when it's tuning. Once in a while, it won't tune properly, and you'll have to do it a second time.
So after you use it, it does it automatically? So
No, I have to press prime tune
okay.
once I get everything attached. So I'm going to get everything ready that he's going to need. So he's already used most of it, but this is going to be his lens, and it's preloaded in this thing, which is
I need
very
a
nice.
chopper.
Oh, I didn't do that. Sorry.
No worries. Thank you.
So I have all this stuff ready for him. I haven't touched anything that he's touched that on with.
Yeah.
And I'm going to go over to the other table. So you don't touch him while I do some over there.
Okay.
So again, we're splitting the nucleus, quadrants. rotate, split, and then move the stuff in the pupil plane. I remove it there. His pupil is smallish and what you call intraocular floppy iris syndrome. It jumps around, it's not very well dilated. So sometimes we use the Maleugan rings for that to stabilize it, but sometimes if it's not that unstable, we can still proceed without the Maleugan ring. So now we're going to remove the epinucleus. Now we protect the capsule, having the chopper underneath. Now the J cannula, always check it. I don't want to be able to move it at all, so because otherwise it's going to inject. Look at the light, my friend. There you go.
Now I've got that sort of half set up, so then I'll come back here. I'm going to
this is
switch
it.
him over to IA from tubing, and he's reaching for all his own stuff. I feel a little badly about that because that's not how I was trained, but that's how he likes it, so that's okay. And our time was 2.4, so always tell your circulator.
I might need a capsule tension ring. He has a little bit of dialysis in the spot here.
So all this other stuff he's done with, so I'm going to get rid of. I'm going to use this syringe once more.
You notice that this area
Back in here.
was a little bit retracted this way.
Refill everything else.
So we'll put the capsule tension ring and we'll do the Yes, yeah, I can close it.
Good?
Yeah.
Do you need anything special?
No, no. Sometimes the Lester, so just keep it handy.
There's no place to stick a finger in there.
Okay. It's just hanging out there, so. Yeah, okay.
So watch on the screen how that goes in, and that's going to stay in there to support the lens.
So, plant it away here. Lester. Okay, let's find the lens. Okay, so do the ID. Get ready by manual. Might need by manual. Let you know.
So that's that 1% of the time
Okay.
that you use something. It's called a capsular tension ring. Okay. So it creates tension on the capsule and supports that lens. And 1 in 500 maybe?
Oh, really?
Not often. Like in a year, well, more than 1 in 500. 1 in 1,000 maybe. Like I haven't used 2 since like a year and a half that I've been back here. And I'm in pretty often.
Yeah.
And finally got to in it.
Let's wait.
I have him here.
Yeah, okay.
See, there's still something there. So left side is kind of that. You're doing an aspiration. Sometimes it's really sticky and it's hard for them to get it out because you don't want to damage your cap, right? Right. You want to leave your eggshell there, but you just want to get all the stuff out from the center of it. Yeah.
Especially that you have the zonule is weak in that area, so.
So I sort of clear the decks, put everything back where it is, so it'll speed up my turnover at the end. If I leave it all till the end, then he's back at the next station before I even start.
So we have to know when to stop. Now the capsule is clean.
Like by the time they cut the last stitch, I should have just my dressing and then wet and dry.
Can you refill that, please?
On my nails.
Can you refill that?
Yeah.
No.
Like I should have everything done. And that way you're not slowing them down on the turnover. Yeah. But everything should be off the nail stand, or if you're using a nail stand or whatever. Sorry.
That's okay. Got her in the face, huh?
So very important. Every time you give him a syringe with anything, really
So
important
put the
to make sure it's
haptics
tight. You don't want him to
vertical.
inject it in the eye and then blow off. Yeah. You know? Not so tight that we can't get it off, right? If we need to, but tight enough. The same with your phaco tip when you use the syringe.
Okay, that's good.
Just give it a little, like don't tighten it for all you can tighten it because then you won't get it off.
Okay, that's good.
But it has to be tight enough that it's not going to leak around it. So all done. I take the IA, the tubing off
Oh,
of it, and I
that-
put it together so it doesn't leak. I'm gonna
Okay,
undo
well,
my
so,
case.
so this is the right second eye patient
So I have all
number
three in my
8.
hand at once.
He had a
because I
small
need to fill them
dialysis
all.
in this area in the first eye, so
And I'm
be
gonna
extra
spill
careful with it.
Stuff all over the place if I do them all separately.
Okay.
So, no, I pushed the prime tune button
As
on the
for the
screen,
smallest
on the
people,
touch screen.
it's
the
big
last
enough to
one,
do the
fill it
surgery
up and then
safely.
just push it on.
The
And
problem
it's-
is it
you
doesn't
have to have
show
fluid in this for it to
this
spin
area
off.
well, so
So then I just set it down, let it do its thing. Another off by yourself. Like that. No, it won't overflow.
it's good. I'm going to cover the
Plunge it
cornea.
back in. There's the Ellsworth, the percolator. Yeah, that's what you get.
Exactly what I get from doing that.
So now this is the second eye. So,
So the size of
I
the
treated
pupil
tests.
is reasonable.
Like I'm not worried about
Not the best, but I don't think you need to dilate it.
because he's already done one eye.
So
So as he's finishing with stuff, I can take it away. This syringe, the little 3cc syringe, I'm going to take the plunger out and Mario's going to put some antibiotic in it. Use the same one that you used for your xylocaine at the beginning. Okay. Yeah.
okay, so I'm not sure if there's something there, but let's see.
That'll teach him.
Okay.
I seem to do them like I should have done that.
So usually if I have time, I'll take this off if the tune is done. And it tells you? Yeah, you'll hear it. Okay. And like it'll go. And then tune complete.
is what it says. I mean, sometimes I'm a little deaf to it
So far
because
so
there's
good.
just another voice in his ear sometimes. But when he takes that, I try to keep an eye that it's not like down too low.
Right.
If it does go too low, it's not the end of the world, but you don't want what went down to come back up. So as
Right.
long as he's got enough rope to do what he needs to do, then I'm okay with that. So then I've taken away the stuff that he's done with.
Because that is just for the beginning.
All that stuff is just for the beginning.
Okay.
Now it's the phaco tip, then he's going to get the epinephrine out with that syringe. It's a J.
Okay.
And then he's going to want Helon to fill the chamber. Helon. Yeah. So this one is Helon as well, but this is called Endocoat. This is the one that uses at the beginning.
Okay.
This is the one that I'm going to use to load the lens, and he's going to inject the eye with this. And again, these are all cannulas. They're not sharp. Just so you.
Yeah, no, that's good to know.
Now, these are preloaded, so the lens is in there somewhere. Can't see it, but it is. And I'm going to put Helon in like through
Okay,
there,
so.
and I want to push it almost all the way to the tip. And then I kind of stick it in here. And I put a little squirt in there. I don't know. I just
Let's go
do.
inside.
And then I'll put his syringe there. So my time is 0.6.
Okay, that's
My
good.
EFX? Yeah, 0.6. So we'll make sure Mario knows that. So 0.6.
Okay, on the radar.
Yeah. Then I'm going to take those tubings off the phaco tip, off the ultrasonic tip, and put them on the IA, irrigation aspiration.
Okay.
So there's no vibration
So I can see
to
a lot
this
of
one.
folding in the capsule. Zonal dialysis.
No, that's what he's using
no
to break up the
dialysis
cataract. That's
actually,
your
but it's
ultrasound
probably
piece. So I fill the
Interzonules.
syringes with the tubing, and then I put the cap on so it does its tune.
But
And then,
zonules, in
um,
case it's still intact.
That's what he uses to break up the cataract. So, you know, whenever he's doing it, you'll see him like kind of cut it
So-
in half. It's like cutting the
Because what happened on the left side, I'm
So
gonna
he kind of halves it,
put
and
the
then he
lens
quarters it,
vertical.
and then he breaks it all up, it sucks out.
it makes it
Breaks
easier
it up, sucks it out.
if that's zonal
And then he'll
lens.
switch
Be
to this.
something that's
'cause
progressive,
he
I'll
doesn't
be able
want
to
to
switch
use
over the lens
too
easier.
much ultrasound on the eye because it's hard on the eye.
Okay, so vertical.
So there, lens is in. While we weren't looking, we got the lens in.
Okay, there you go.
All my
That's
stuff's back in
good.
my tray.
Okay,
My sharps are all
that
here, so
looks
I can
good.
just go and out. And I just have to take that phaco tip off of here.
Oh. That's great.
And
There's
every
some
once
sorts
in
of
a while-
zonal laxity because
Every once
chamber
in a
becomes
while,
very,
when he's
very
done with this, he's usually done with it. But once in a blue moon, he'll go to irrigate with one of these, and there'll be a little piece that comes out from underneath the yard. And you're like, oh shit, I gotta get it ready. We need the bathroom done.
Okay.
So I'll wait until he grabs his little one top syringe before. Yeah, that's my cue. That now he's done. Now I can take this off. I can unplug that. I can contaminate myself. I'm good. But until he does that, and it's a
See,
bad
the
habit,
folding
like,
of
I
the
try to get
capsule
everything
is
Yeah.
one of the
clear.
signs of
So sometimes I
zonal
forget, I
laxity.
undo this, and he says, "Oh no, I want
And see
that."
the
And I'm like,
ovalization of
But
the
it's like
rexus,
1%
also another sign.
He'll want it, but that 1% he doesn't want to wait.
Okay.
It's better that I wait than he has to wait. So now he's contaminated, so I can feel. So I usually push end case, and I push next case on there.
And we're all done. Both eyes went great. You have a little bit weakness in the support of the lenses, so but everything went well. So dealt with it. Okay.
That's okay.
We are starting on the right eye of patient number 9. For Caesar capsular cataract.
Well, then this is a great spot for you.
It is.
She She is 48. Yeah, kind of young for that stuff.
Crazy.
Yeah,
I'll skirt myself in the eye with that.
there you go. Let's give you some extra freezing. This will bite a little bit, that one. Here
Yeah.
it comes. Bear with
This
me.
is a J, so it skirts back on your.
Yeah, that's the one.
That's why I say, like, I can't.
This is incredible.
Yeah, that's amazing, huh?
Yeah, so probably
Yeah,
do the better at
yeah,
it
that's
than I am.
good. You're doing really well.
So again, this is his lens. It's preloaded in this pink, so I'm just going to fill that chamber with this hue on.
Okay.
And
Now
then
the
I like to put a little
the
bit-
lights are gonna change color and shape. It becomes very psychedelic.
Isn't that something?
Yeah, this is the actual effect of that fluid, not the sedation we gave you.
Did you hear that?
You're not high enough yet.
Anyway. So it's done.
There you go.
So I can take the cap off of that. It's ready to go. All this stuff he's used, this is the two things remaining to use, plus these. Okay. But I can walk away now. He's content to do his own thing. So I'm going to go over here. Do my best to set a little bit of this up before he's done the big one. I have to go back. So again, same order. He likes that little column to dry, so I put that under the grate. And then maybe some gloves, yeah, some gloves. And
Okay. Looking good. Everything's going well. She's 48, so it's going to be a very soft cataract. Okay.
so grapes, down gloves,
My dog just checked a little bit more.
then I'll put it in a little garbage bag. Open the top. Kind of, I don't open the garbage bag, then everything's everywhere and the stuff's underneath what I want. Well, your food really fast. Yeah, because he uses stuff basically once, so you don't have to go, oh, you don't use that? Oh, maybe I should leave it out. No, don't leave it out. Don't use it. Just don't throw it.
Almost no fake at all. It's just the IA.
So first three things, then your blades.
So be very careful with the soft cataracts. It can easily go through it, so be extra careful. Soft cataract is not an easy surgery. Sometimes it can be very difficult. Yeah. You're doing great, my dear. Everything's going well.
Thank you.
You're welcome. Keep looking at the lights. You might feel a bit of pressure now. That's normal.
We did that last time.
Okay, that's great. Clean up well. That's excellent. Doing really well, my dear. Doing great. So this is going to be the lens going in a few seconds. There we go. Okay, that's the lens.
Now these are the other things that you can use.
There we
That's
go.
it for now, until I can set this up, until I can do the other stuff. That's all I can do for now, and he's actually putting the lens in, so I should see that. That's the one I'm gonna use to load the lens, and that's the one he's gonna put in the eye with the oil. So that's all I can do for now. Are you okay? Sorry.
Yep. Right.
I was chatting.
Yeah, no, that's okay. Don't need to for that step. It's okay. You can finish what you're doing there. Don't say, don't give you time, so there you go.
It's all relative, really.
Yeah. Look at the light. There we go.
So
So good thing to remember, just be gentle. Like it's good to go fast, but you have to get good at handling stuff before you get too fast, because everything's very delicate in here and breaks or bends really easy. Okay. So don't worry. He'd rather you go a little slower than bend the inch. So
I agree.
I always tell people they have to get good before they get fast. So So don't worry about the speed.
Temporarily.
Temporarily. Okay.
Just FYI.
Right?
You'll have a couple cases and
3 strikes and then you're out. It's not like ortho where everything's like just hammer and friggin' pound. and
Oh,
whatever.
done for this one.
Stuff here
Okay,
that you, like,
there you go.
have to-
So this is the left second eye patient number 9.
It's down with salt too.
Keep looking at the light. Look at the light. That's your only job today.
And I have to actually touch it. So that's my eye.
There we go. Give you some extra freezing. This will bite a little bit, my dear. This is just normal. There it comes. That's the one.
Oh yeah.
Does bite.
And he's already used these things. I'm going to take those away. And I usually line these up where he can reach them in the order that he wants them. So that is the syringe that he's going to want shortly. Oh, sorry.
It's too quick.
That's the syringe he's going to want at the beginning. So before he does the phacoing, he'll do his capsulorhexis. He'll peel away that little circle in the middle with this. Then he's going to do hydrodissection with this, kind of separate things so it'll be more easy to come out after. So that's the point where I should have this primed by then, because he needs that syringe at that point.
Oh right.
He's already done with this, so I'm just gonna put it there, then we'll put some stuff in it. Now if they don't hear, it's not a big deal, because it's the very last thing to see. But you know, if the lens is in and they haven't filled it yet, then I'll say, hey, can you fill that up? Because sometimes I'm over setting up the other table and I don't want to cross contaminate, so I have to run back to take the plunger out of the deck.
If you want, I can take that. Do what you. Take the plunger out. You want to do that?
No, that's okay.
That's okay.
That's all right.
Doesn't
I
take
gotta
me
come
long.
back eventually. It's
Yeah.
okay.
Maybe that's one modification I'll do today. Good
Done
feedback.
with that. Next thing he's gonna, when he's done stapling, when he's done taking out the hard part of the lens, then he's gonna want that jade manual to get the softer part. So that's there. Then he's gonna want this, so I wanna go ahead and inject it into my lens here. These three folded ones are.
The effects is 0, yeah. Okay.
The index is 0, so that wasn't a hard cap.
It's the age. That's why she's very young. She's 48.
I'll leave the chopper up there because sometimes when the lens goes in, it just needs to be sort of dialed in or adjusted. So I don't put the chopper away yet. But I am going to turn, he already gave her the time, it's 0, 0.00. So I'm going to take my tubing off my phaco tip, put it on the IA tip. And then I'm going to IA's the blue one on here, so I'm just going to touch that so it's ready for him for after. Okay. I'm done with those.
This is the lens going in, my dear. Almost done.
And you can see how clear it is. Like, yeah. So we did adjust it a little bit with that chopper. Those are the last two things that he's going to want. Yeah, the key to going quicker is just knowing what order that he's going to want stuff in. And then when he's done with stuff, clear it away.
like for any case, not just the eye cases, but for any case. And then when, by the time he takes the drape off, you're already cleaned up after. You're ready to go. Sometimes fell apart on your turnover times and whatever. So if you can shave like a minute here, a minute there, it makes a big difference when you're doing 30 cases.
Yeah.
If you can shave a minute off, that's a half hour at the end of the day.
Yeah.
You know?
And we're all done, my dear. Everyone well. So we have the left first eye of patient number 10.
Hey, that's
Okay.
probably dancing.
Keep looking there. It's your only job today. Average cornea.
Just that and the one underneath.
see.
There you go. I'm gonna give you some extra freezing.
The one underneath
yeah,
has
yeah.
your phaco in it.
So this is gonna bite a little bit here. Here it comes. That's the one. Yeah, that bites a little bit. That one.
Ow.
Yeah, that's the
Ow.
yeah. Okay, this. Now the lights are gonna become very psychedelic in a second. Here,
Oh, wow.
yeah. There you go.
Yeah.
Enjoy. You got the color show.
Light show.
That's cool. Have to keep you off what you're doing.
Yeah. Let's keep looking there. That's good. Doing very well. There you go.
Hey.
That's the no name and the brand name.
Okay, so now it's very important to keep looking at the light. That's good.
Look at it.
Uh-huh.
Yeah, that's kind of cool.
Yes, it is, huh?
Going away.
Everything's going well. I'm breaking up the cataract. That's why the light is now is a little dimmer.
So can you hear it? Yeah. Now it'll say time complete.
Yeah,
Looks kind of funky.
it's doing very well. That's good. Now I'm going to use an ultrasound to break up the cataract, so you're going to hear some buzzing noise. That's
Oh,
normal.
yeah, yeah.
Yes, there you go.
Okay. The little circle right after. And then right before the little one after. And the blue thing. That's the cataract. That's what you feel that.
So you can't make my eyes blue and green, eh?
No, no, he's staying with the nice brown color.
Well, people always say I'm full of shit right up to my eyes. So, you know.
Yeah, that was beautiful. Yeah, so doing well.
Well, it shows when you want to close your eyes, you can't.
That's what's happening. Yeah, of course, yeah, other eye can do that, but this one we have something to prevent you from doing that. Okay, that's good. Everything's going really nice.
Still facing, I
Yeah,
can tell it.
yeah.
Come on, Doc, you know, like in the 60s when you got stoned and you felt
Yeah. So just keep looking at the lights. You're doing really well. You might feel a bit of pressure doing this next step. Just bear with me.
Oh, that's taking the right step.
Yeah, there you go. I'm just cleaning up to implant the lens.
You can't do anything about those photos, eh?
Floaters, no. Unfortunately, there is a laser for them, but not everybody can benefit from that. That's
Don't do that.
yeah, and unfortunately, cataracts doesn't help them. Actually, after surgery, you're gonna see them clearer. So don't expect it to go away with the surgery. So that's good.
It's like two teddy bears dancing.
Here comes the lens. This is the lens going in now. There we go.
Oh, that's a pretty blue. Ooh,
There you go.
that is pretty.
That's the lens going in. That's good. Doing really well. Excellent. So looks really nice.
Ooh, I like that blue.
Good.
I think he's got another tattoo.
There we go. That's cool.
That's kind
Can
of
you
neat.
put us some antibiotics there, Debbie? There you go. That's, there you go. Sorry. Sure. Yeah. A bit of pressure.
Boy, you like that.
Yeah, I know. There we go. That's good.
Ah,
There you go.
This is true. No, but this slides on, but I usually slide and turn at the same time to make sure that
There we go. They're doing really well down there. That's great.
So we're all set. We just have to screw in our staple kit. And here.
it looks like a big mushroom with little mushrooms.
Yeah, the lights. The lights of the microscope appears as multiple patients described as mushrooms.
That's what they look like.
Yeah.
They're pretty.
Yeah.
Am I talking too much?
No, that's okay. That's okay. She's dropless, right? I need the dropless, guys. Yes.
But they're not doing anything now, though. They're just hanging there.
Yeah, I'm just gonna finish it up. In a second, here will be all done.
Ow.
Oh, done. That's it.
I heard.
That's hers, the last one. I'm gonna put some extra freezing in the bottom. Okay. So this is the right second eye of patient number 10. You did great first one, my dear. So let's just start this one. Give you some extra freezing. This will bite.
Right to 10 in your mind. And then just move to the next syringe, then move to the cap. Good. Down. Then you can set that down, it'll do its thing.
Okay.
You're going to take your plungers, put it in the blue one first if you have a choice. And just flip it upside down, get the air out. Straight up, so that you get all the air.
Okay.
And put that right here.
Alright.
That's his next thing. Same thing with that. That he's not going to do until after he's done. So there's no rush to get that anywhere.
Okay, leave it here.
Yep. So that tune's complete. So you can take the cap off of that form so it's ready to go. And just move your table in so there's not such a gap here so your tubing won't belly down. You know what I mean? Pull the whole out.
Pull the whole thing.
Yeah. It'll angle a bit, but yeah. Okay. Yeah, you only need it for the tune.
Oh, okay.
So now he's done with all of these things.
Okay.
So you can start putting them back in your tray. While it's stapling. That makes no difference how you put them in. They're usually in a certain order when you get them from like when you get your tray. Now that little 3 cc syringe, we're going to take the plunger out of it and they're going to give us some antibiotics for the again. And just angle it in here so it's sitting and they can fill it up. Charts you're done with, those you're done with, this you're done with. And now we can load our lens. So we take it out of there. You're going to put some Helon in that bigger in this here. It's all ready to go.
I'm not seeing pretty
So
colors.
fill it.
No, at this stage you don't see the pretty colors. No, at this stage we're breaking the cataract. So the pretty color was earlier in the surgery.
And then I put a little squirt on the other two over here. But you have to sort of angle it for me. That's good.
Okay.
So put that on the
Yeah,
side.
really well.
Bend your lens. Now, detach your tubings from that and put them on the IE tip.
Put the light. There
And
you go.
just push the blue LED button on the left of the screen. There you go. So that's ready to go. Debbie came over and gave me some antibiotics, so I put some thunder back in there.
Okay.
So that's the order of all the stuff. Okay. You can take your phaco wrench and take that phaco tip off because you're done with the ultrasound part. You'll want just irrigation aspiration, but the hard part of the cataract is on. The hard part is on.
So take off the yellow piece.
So take off the yellow piece and then you're going to use your wrench to loosen that tip.
So just pull off.
You can pull and twist at the same time. The same way it went on. Pull, like,
Oh, God.
pull up and twist. Yeah, perfect. And take your wrench and loosen that baby. But like, you get it?
Yeah, got it.
Perfect. So the wrench in here is not going to move you. There's nothing wrong with
That was the lens going in, but you're almost done here, by the way.
So that'll go. I
Yeah,
put it in the chart.
really well.
Yeah. For no good
Okay,
reason.
that's great.
And that's that. So those are the last two things. Done. Okay. So now he's gonna go after his screen. And we'll only take those two things off once he contaminates himself and reaches for that screen. Okay. But that'll be our next step. And then we clear it out, start over.
Sounds like somebody's in
1.1
training.
was our
Yeah, we have a nurse in training. Yes, we do. Yeah, that's true. The next generation.
The only way to get a break, we gotta train people.
Yeah.
Yeah.
Okay, you got one. Get after all us old people.
Right? So if you're okay, we'll do this for the rest of it. You do the second eye, I'll do the first eye. Because you did really well. That was perfect.
Oh, thank you.
So under your tubing, I'll take your sharps. And he's going to give you this microscope handle and the speculum. And then we'll get back once
So this time you didn't feel that needle. It's
Oh, I
done.
felt a little bit.
Yeah. So see this the freezing. When you squeeze your eyes, you kick out the freezing, and it doesn't freeze well. Okay, so this is the right first eye patient number 11. Okay.
later. I know.
Some
This
extra
is good.
freezing. This will.
You'd make a good puppy
Yeah.
someday. Maybe in my next life. Next life, you'll be a good little dog. Be a friend. Pampered. Hopefully not break my back. I don't think I'd be that athletic if that's the case, though. Not that athletic. I'll be some lazy lab eating all the leftovers. If I come back as a dog, I'll be a lazy old Labrador. I like this song. It's at the end of Night at the Museum. Yes. I like this song.
Yeah, that's right.
Yeah. I like that movie.
Yeah. Creative idea.
It's almost before I'm set up. Like, and then I come over here and then I start all of it. But you've already got most of that. Yeah, that's the main one. They've got it apart though. Okay. So see this thread going on one end? So the part that has the thread is in the bottom. Okay. Screw that one. And then it's going to go on here. Your little screw-in one with your yellow tip is the one that goes on your table. Push it down and turn at the same time. Yeah, just so there's no gap. And then so that's for later, and this is for arm. So this clean stuff. So that's clean and peel pack these two things together, and your pack, and then another pack. Those all come in the peel pack together. And the wrench.
tighten it down first, otherwise it won't tune properly. And then you gotta take it apart, retighten it, and then tune it again. So that's ready to go. And you're going to want this, and this. Yeah, it's the loose one. The blue one that goes on this is the one that's in that little blue box or whatever. So these two big ones for the box. Yeah, okay. And then this peachy colored one is the one that is in the blue. So if you load that, take your plunger out and just tip it on the side there, then you'll feel it for you. Now it'll go here. These ones here.
There's some antibiotics here. Heather, can you give me some antibiotics? Is the lens going in, my dear? All doing very, very well. One of my
Because
patients.
how embarrassing would it be if he was huge and he didn't fit in? Right?
Actually, they had one. One of my patients told me that they had actually to open the seam for one of the
For one of
previous
Big
popes. Big popes. Yeah, it was actually they have to open it for him. Was
So
it?
since then, they
was it
probably have
a
little
zipper
bit
or
of
something?
variety.
Maybe a zipper, hidden zipper somewhere.
You know, first day is just for show, you know, you can't
Yeah.
pick their wardrobe out. Well, this is beautiful.
Yeah. We want someone that took some sense into the world, because the world was going crazy.
Well, the people that are crazy aren't going to listen to the Pope anyway.
Well, you never know.
No, I watched it last week. It was good.
I watched part of it. I didn't finish it, but I think I have to finish it now. So.
I'm sure it was pretty good how it ended, but I
Well, I didn't guess
no
the
spoilers. No
I
spoilers.
didn't guess the ending
She's
until the end.
dropless, Heather. Dropless, is it? The Judy, yeah, dropless.
she's dropping.
That's Bernadette. Oh. Okay, thank you. Thank you.
Yeah, I thought it was good. But I like John Lithgow, and I like Ralph Fiennes or whatever his name
Oh,
is.
done. They're great.
Good.
So this is the left second eye patient number 11.
It doesn't pull, turn it, see what happens. Okay. And then it screws into the bottom of here, that's your plunger. Just hold on to this. And
Some extra freezing. This will bite a little bit.
Okay. Then split that. Grab this piece of garbage, screw that onto the end.
Pretty colors.
Now,
Yes, they are.
push the plunger up separately.
Very psychedelic.
Yeah.
Just slide it up so you can see this go into the little there. And then I'll take the cap off. Now push it up to make sure you have some scrutiny and gently. Okay. So you're going to use it to load your lens. You can use it now or later, but he's done with some of that other stuff. So if you want to clear that up, you can get rid of it. The 360, take your plunger out and just leave it open there for somebody to fill out later. That's good. And your other three things can all go back in their tray.
So you can take your cap off of that. It's done its tune. If it doesn't tune properly, there'll be an error code that comes up on it, and it'll go.
So there's an error there, but it's gray. Gray.
That's from this morning.
This is a. We can clear that up by pressing here. It will disappear. The active errors will be blue.
Oh.
So if you look here in the
So next you can use that, and then it'll be the one.
Nicole, look at the look in the monitor for a second. If you'll see here, the edge of that thing is cut.
Oh, the
It
edge
says,
of
yeah,
yellow
yeah, yellow thing. So what happened is that when you're putting in, it just snapped that part. So it still works, but
Oh, I didn't
give
know
it
that.
yeah,
I thought
it's
it
okay.
looked good.
It looks okay, you know, it's looks right, but it's the edge of it is ripped. If you look here,
Oh.
this,
Yeah.
you won't see it except on the
Just
microscope. Yeah,
It just takes time to get the
Yeah.
glue.
yeah,
It looked good to me when I looked at
yeah.
it, but it's, alright.
It's need a microscope to see that.
Yeah.
So,
Yeah.
yeah.
So this one here, this is the right
Yep. Yep, so fill that up to the tip.
Okay.
Okay, so this next, then your lens, then this, then this. Then it over the top, and we weren't open. Sneaky. I said you're over the top when we weren't open.
Oh, for me?
And then that's the very last thing you're gonna do. So when he's done with that staple, you're gonna switch this over. And he's done. So we'll take the tubings off of it and put them onto here. And push IA on your screen, the blue one. And our time is 0.6. So Heather's gonna write that down. Now, if you want to take your phaco tip off now, you can. Usually if I have a minute, I do, but sometimes when I got the time on my hands. Or lack of it. I find if I, like, if it's like a really hard cataract and it's taking a while, I kind of don't know what to do with myself because I'm not used to being able to stand and actually watch. I'm like thinking I'm forgetting something if I have too much time on my hands here.
That's why in the office I have an extra room on the side. So when you have time, you go prepare the third and fourth table. Yeah.
So there, lens is in. He's doing the IA. He's done with that. I'll put it in your tray. And then these are the last two things we're just going to do. That's it. Yes. I'll be in the lounge till 3.
No, you'll be right there with me.
It's good. Like, it's good, I find, to train in here because it's repetitive.
Yes.
You're going to do it exactly the same way. Like that first one that you watched that he used the capsular retention ring.
Yeah.
Never happens. Like,
Oh.
very rarely. So when I say it's always the same, it's not always, but 99% of the time it's always the same order, always the same, like, you know, sometimes it's a little bit thicker of cataract or harder cataract, so it takes them a little bit longer, like your time might be 5.2 instead of 0.6,
Okay.
you know, so then you got a little more time on your hands to do other things.
So that's
Yeah,
our
so then
cue.
you can take that apart.
And we're all done, my dear.
Oh,
Both
good.
eyes went great, so just going to take that off. So when you take the speculum out, hold it well, and don't let it flip. So you can see here. There you go. So this is the left first eye, patient number 12. I'll give you some extra freezing. This will bite a little bit, my dear, so just bear with me. Here it comes. That's the one. That's the one. This is the freezing. We started the surgery already. Everything is going really well. Hope you enjoy the nice color show. There you go.
First American Pope. American? Oh, that's so awful. Ugh. What's XIV? 10? 14. Or XIV? X is 10, V is 5, and if it's 1 before 5.
The new pope is revealed as Robert Preble, the first American pontiff in history. He will be known as Pope Leo XIV. Oh, we'll Trump will have.
Yeah. It'll be very beautiful. Very, very beautiful.
Yeah. Why is it
It has no other adjectives than those.
Well, I mean, the next best thing to him is good Lord. Continue to feel it. Higher than that. Let's just work it. And the easier when it was straight. See, when it was sidewall, so just pull up. Like if your glove, if your finger's not in your glove, like just pull it out. Well, to me. But usually I keep pushing down and placing over time until I get it to go through, and then I go real slow at the end and make sure it goes out center line. So that looks good. That looks good. This one looks good. Okay. That's ready to go. What's a little peachy color? Like see, that one's gray. This one's a little peachy. Good. Not much. Continue to feel patient. 1.3. On a little string, yeah. And then flip it upside down or whatever you can under it. And it'll go here beside it. But otherwise it looks good. And then so that'll go in front of that if you want. I'd like to 100% antibiotic or local? That's antibiotic. Really? Oh. Was it local?
Some antibiotics here. Okay. Thank you.
Now this one we're going to have to pull. I think that was a very political choice. I think you yeah, probably over here for Berlin.
So 1.3. 1.3?
So this is the right second eye patient number 12.
So we have you treating onto that.
Doing really well. Everything's going great, my dear. You can feel a bit of a bite now. This is the freezing.
Come on over here. We'll pull that in close.
That's the one.
You can just pull from the tray?
Yeah, pull from the tray. And you want it just close to him. Close the gap. Yeah, that's good.
There.
Okay, so now you want these three and prime two.
Oh, I forgot the other one. Thanks.
Just want your two more to hold involved. Wow. Okay?
Yep.
100. That's what he's going to want next.
First timing.
Okay? That's the after one. Okay? So that's almost done. So when it says prime and two is done, we'll take the cap off and then he's going to grab it next. Okay. So all done with these three. He's starting his phaco now. So then the next one will be jade cannula. And then our Elon and our lens. So we're going to have to hold our lens. So we haven't seen these yet.
No.
So this is the inserter. I'm losing my words. I go into autopilot sometimes. So this is the unfolder. It's called the green box there.
Okay.
The unfolder. So the lens is in here.
Okay.
So you take a forceps, it's a smooth forceps that is called a person, and it's a tying forceps. It's a tie fingers, which is what they use. Because you can't tie with your fingers because it's too hard. So pick it up very gently, like that. So the center part, the circle part, is called the optic, and the two little arms are called haptics. So the arms, the haptics are what hold it in place and the optics are what hold it in place. Can you take the cap off that? And the same as the other one, you're going to fill this part up, like from here.
In here?
Yeah. Fill that part up pretty decent. Good.
Okay.
And then put just a little tiny strip up both of those.
Like that?
Yeah. Even a little less next time.
Okay.
So I want to put this in. It's got to go under the lip on that. I don't know if you can see, it's like frosted. There's like a picture of the lens there.
Yeah.
Sometimes you tip it
A little bit.
Anyway, so you want both sides of the round part under that lip so that it will slide up through the cannula. That haptic at the front, the leading one, needs to be down and go through that part first. So you want to make sure you push it down. I'm going to put it down and I just want to hold this down so it doesn't pop right up while I'm folding that up. And the trailing haptic, I want to fold it up over top of that and just make sure it stays on top of it while I fold that and it goes in here. If it's not folded on top, sometimes it'll pull right off and you can't use it. It won't stay properly.
And there's only one lens, obviously.
There's only one. So if I pull it off, then this is garbage and have to get me a new lens. And then they get it going a little bit because then they have to take the stickers off the chart because we already stuck on this one and put different stickers on. It happens. Like, I think I did one a couple weeks ago. I did it. Not on purpose, but it happens. Anyway. So we can take our phaco tip off. That's a whole separate thing that you just need to learn. But if you get this down, this is tough. It just takes practice.
And I'm just as happy when a lot of the patients have the pre-folded ones, but see if she's got them all lined up,
Oh, ready to go.
ready to go, and those are not pre-folded ones. You're gonna have to fold the rest of them today.
And this goes in the sharps, eh?
I usually stick it in the sharp. Just, hey, even though it's not sharp, it'll poke through the garbage.
Yeah.
Cause-
No, it just looks
yeah.
like something that could be sterilized and be used. but
No,
not.
it's a single use. So that's that. And we'll do it all this started. Are you tired of doing this?
No, I'm good.
You good?
I mean,
Probably better. There's only two left to do.
Oh.
So we should be done by
Yeah,
by
so
2:30.
early.
Hopefully done with that.
I really try
Are you losing loose this time?
I'm almost
Really
done.
didn't put it tight.
You're almost
My
done.
right eye is really hurting.
Really what?
Yeah, okay.
Yeah.
It's almost done.
Yeah, thank you.
All done.
Yeah, you have-
This is the right first eye of patient number 13. Okay, you can keep looking at the light. There you go. She has narrow angles. That's previous peripheroidectomy. That's posterior subcapsular cataract, dense. And she's getting injections for diabetes.
Yeah, it's just there. Okay, that's normal. So that can go on that tip, goes on that piece there. And the yellow one, the safer one, you know, the first one that she took off, that goes on that one. Yeah. That one, yeah, will be yellow. It does. That's a lot of little things.
Yeah, it's all little things.
What's it?
Once it clicks, you're good.
Just takes a bit of time. Looking at the way
We've got this one and then two more.
You want to go break?
I think we're okay for now, eh, Nicole?
Yeah, I think so.
Okay.
If anything changes, I will check in on you.
Okay.
Get a change of hot.
Change of hot. I do need to be out.
Stuff with Mario is a little rough.
Oh, he's just relieving. It's only been a couple minutes. We're okay for now. It's only been a couple minutes. Eh, Marion?
We need him for his muscles.
Yeah. There you go. We had to loosen that blue piece and get him to take it off. Yep. So getting the cat out of the tree. So on that first, and this, and that. That's it. And now your big circle, your big circle thing. Then your two blades, and then your local connecting on the 360 thing. So find your little thing. This is for you. You'll always feel this big guy. Oh, okay. I know, there's stuff you don't need in it. So that's good. Give that a little twirl. Make sure it's tight. Good. Got it. Okay. Now this one. Yep. Yeah. That's way more than 3 minutes. It's pretty stingy. Okay. So that's over there. So then it was this one further like that. That is going to go here after the blade. I think it goes in between the blades, but I usually just the blades and then then the little circle, then the blue thing, like a little rectangle towards it, and then the chopper. So I didn't show you the difference. You see the difference between the chopper and the lesser? Yeah. One's like an L, and the other one has a little piece out and then a piece up the back. Yeah. Kind of. Anyway, lesser, chopper. Sometimes you don't mix them up and they go in here. Chopper? Yeah. Like a Harley. Okay. You know? Yeah. Okay. So you're going to throw that together.
So EFX is 3.5.
3.5 on the right.
And that's gonna go after the phaco, with our tubing, after that later, like after the hard part of the some of them are a little bit.
Now you can put us some antibiotics.
Mosey on. Well, he had 2 last week because
Yeah.
Nick was scrubbing. So Nick would do 1 and I'd do 1.
Oh, okay.
I'm liking it.
Well, you request next week.
Is that what I have?
I don't know.
I request next week to me?
I don't know. Yeah. Then you'll be here all the time. You'll be the new Kevin. Oh, you won't get in here next week then.
3 to 11,
Yeah.
week after. No, I'm off.
Well, fair weather friend, that's why you're never scrubbed in here. You're never here.
I'm like that dude, casual.
Just casual full time.
I have a better casual. You still have to work more.
Did you get your time? It was 3.5. 3.5.
Yeah. And we're all done for this one, my dear. You got one 3D well. Okay. This is the left second eye of patient number 13. Some extra freezing, my dear. Is gonna feel a bite to it. Okay. That's the one. Just keep looking at the light. That's the best thing to do today to help out. I know it's bright. It gets dimmer as time passes.
I wait until the draft out. Yeah.
So we'll wait till he starts his phaco, and then we'll fold that one. But this is going to be, this is the tricky fold. The rest of them for the day.
Okay.
No pressure.
It's not
No,
fun.
no, no.
It's not fun.
Okay.
But we used to, like when I learned, the rep would come and he'd have like a whole bunch of lenses in the lounge and we'd all just
Sit there.
sit there and practice and practice and practice.
Even
it wouldn't be
expired
like on
ones,
here.
yeah. We used to keep some expired ones
Yeah.
to draft.
But now there's no practice. Like it's, you're on the spot.
Yeah.
Alright, so he's gonna start that, so we're gonna start this. So, just bring that in a little closer so you don't have any gap. Nothing hanging in between. Yeah, that's, no, it's good. Okay. So, again, we're gonna fill the chamber. And I want just a little scratch down the tray. Just a little bit. Okay, not very much. Okay. Then I'm gonna take my forceps. I want to pick up the lens gently. And can you see the picture on the wings of that? Like it's frosted. Can you see like a little circle with the haptic up here? Oh yes, it can. Yeah. So that's the way that we want it to sit in the tray, like the haptic facing that way.
Okay.
So if for some reason this gets flipped the other way, then that's not the way it goes. You want it to go in facing that way, the same as that picture. So I want to put this like under the groove.
EFX is 0.6.
Like I don't want to stay on
It's a
top of
0.6,
that.
just 0.6.
Both sides have to go fit underneath that groove in the tray. So I put the first side under already.
Then I'll set it down, and then I'll close this and use it to push the other side down and retrain it.
So there's two lips.
There's two lips on the lip on both sides. It has to go under. That leading bracket has to be pointed towards the inside of that tube, so it doesn't get cut off. When I pull this up, I'm gonna push down on the center while I pull up on the wings. And before I fold it all up, I want to
Put the light in there. Almost done here.
fold it over the top. He says it does it. Fold it up, both the half pitch to where they belong, and I'm going to give it to him. Now he knows the feel of it. So if he starts to screw that and he doesn't see the leading half to come out, he may say, I don't want to use this one. Fold it out.
Yeah, let's check it out.
All this can go.
And this you just top load it?
Yeah. So unscrew the bottom of it. All the way out, and then that'll slide up and out. Oops, yeah, there we go. Okay, good. Put it in there. Here, yep. Sure, sir. She's got her last two syringes there. And then we'll put our baby stuff on. Okay. Go ahead and take it off.
Yes.
Your yellow one. Leave the IA alone, but you can take that off. So then you can disconnect the whole thing because he's onto his last syringe.
And they're all done. Both lines went great, my dear. Okay, there you go. So this is the left and first eye of patient number 14. It's mature cataract and myopia. The lens implant is 30 maximum able. I use vision blue because it's visualization is not easy. Okay.
Well, I have a spare, as it turns out.
Do you? Maybe
I do.
two bucks.
I do, because I had a straight tip and Deb had to open me a curved one. So I do have a spare yellow tip in my little baggie.
What do you have on the other table for your first?
The freezing,
Is it
this is
straight tip or curved?
the bite you feel now, that's normal. The shallow chamber
Do you have a tip?
and thick cornea.
Yellow rubber thing? Yeah, like the little metal tip that goes with the yellow
Yes.
rubber thing.
I have the yellow. I mean,
The thing? Okay. Sometimes it rolls off the table now, or sometimes it'll be under here. There it is.
Yeah, some dopey guy, so he's not be able to tell me to look at the light. Okay.
Now, Nicole, do you want to watch me once more? Hold that lens, and then you're going to do the next one.
sure.
Okay.
See, now we can see very clearly the
Hot
red
dog in the
cells.
bun. Taco in the shell. Whatever. Your
So vision blue helps a lot with this kind of cases. So whenever you think that you need the vision blue, probably you need to use the vision blue if you are thinking about it.
Yeah. Oh, it could be that too. Yeesh.
Okay, that's good. Keep looking at the light, my friend. The four little lights. Can you? There you go. That's the only job today. Yeah. Yeah, so it's just don't move your head. Just keep looking at the light. Don't move your head.
It's on the left side.
It's
You're
you're-
I asked him, he sank.
So.
okay. So
lay-
just look,
lay
keep looking
between
there.
the two
Okay.
circly things.
Okay.
More than full.
Yeah.
Okay.
Lay
That
one
doesn't
first,
matter. But just keep look
little
towards
Now it's
them.
full house.
Yeah. Okay. Here you go.
chopper
So
at
just
the
keep
end.
look towards them. Okay. Don't move your head. Okay. Just keep looking at them.
I think it's beside your P-line. At the end.
Now it's a bundle.
Yeah.
Okay.
That looks good.
Just keep looking at the light. Okay.
This we don't use, right? No. Throw it out. All right, I'm gonna start folding that lens. If you wanna watch once more before I make you do it. Yeah. So I want to fill that. Pretty.
Again, if you think about doing Vision Blue, just use the Vision Blue. If you thought about it. Okay.
Then if there's too much gel in there, I'm not gonna be able to see what's in it.
I never regretted using the Vision Blue, but I regretted not using the Vision Blue.
I cut this out, force it, got my gel in there. And I always want to do this over a table. So if I drop it, I'd rather drop it on the table and pick it back up than off the floor. So again, I want to angle it so that one side goes under the lip. Then I can wrestle with both sides. This side, I want to keep my forceps together and push down so that
There's not much epinucleus, it's all just
like almost a
a
little
big
clip.
nuclear fragment.
That
So,
being half-it is going where I want it to go. Just gonna make sure that it
so here you get be careful with the last
and
piece.
it'll go into that tube. Now hold it down. This is together still, and I'm gonna hold it down as I fold these up so that it doesn't pop up. I want to take that trailing mattress and fold it over. And be able to fold one leg go. The one leg is yoga pose, and then it's in there. Okay? Okay. Don't worry, I'll go through everything. I just thought I'd give you one more look-see and. Yeah, for sure.
Now with the last piece, chopper should be behind the piece, or you can fill it with viscoelastic.
So we missed it, but he used Vision Blue on this. Oh. So the capsule. The last one has 3.5 heavy. But you can still see a little bit of blue. So it comes in its own little syringe, and I'll have to give you a separate cannula. Okay. And it stains. Okay. So it's like methylene blue over in the other room. You know, when you're doing a breast. No. Oh. Yeah. It stains. Okay. Any blue stuff? Try not to get it on anything that you want to keep. Try not to spray it at the wall. No. Yeah. Don't squirt your circulator with that. No. Not even for fun. I think I did a stroke on one day. I was like, this went all over the wall. The blue or the black? The ink or the blue? Oh. Yeah, yeah.
See the one is long because of his very thick cornea. Okay, look above your head. And we're all done for this one. You did great. One down, one to go. This is the right second eye of patient number 14. Okay, so we have the right eye, so 27.0, blue wave 27, 11.3, and 622. That's good, thank you.
Safest way not to do it alone, you got nobody, is to use your foot.
Okay.
Like pull it on that, but use your foot.
Oh, we need some local. Local?
Local? How do we do local? What?
Just a little, just a 0.3 that would be fine. That's good. Okay. Give you some extra freezing. This will bite a little. That's the one.
I do that too. I'm clearing the decks and I'm like, where's all my stuff? And I look in here and that's exactly where it is.
Bonnie, you can start playing around with the lens right away.
Okay.
Don't wait for the fake.
Don't wait
just
for you?
just wait.
Okay.
Yeah. So when the position of the eye is not that suitable, you can use a chopper and put it in a suitable position.
So pull through the side. Okay. I need another sleeve cover. Like under sleeve for my facial. Because it won't tune properly. If there's a hole in it.
Could we get
If you what you can do, you can actually just plug it with your finger. Yeah. Okay, so just pull it out. And just okay, put it back in. Okay.
I just don't
And,
know what's it.
And just see where it's. I think it's gonna seal.
That's
Okay.
that one. Okay.
So just wait. Just wait.
wait?
Wait a second. Look at the light. Huh?
That's what I'm saying. Yeah, I don't know.
Your fingers be wet. If it did. No, I don't think it did. I don't know. You'd see like a wet spot under the glove. Maybe it's just right.
You want to take it off?
No,
Check?
I think you notice if it pokes through, then it'll feel that way. You know what I mean?
Yeah.
Compared to your other fingers.
There you go.
Okay, so we're gonna start that lens.
Okay.
So we'll take that, and this.
And then okay, so this is first.
So that's first. So fill that and just a little bit down the canal there. Just a little tiny bit. Okay. So now we're going to take our lens. We've got our you guys ready there. Now that'll open like it turns to one side or the other, whichever side you like. Just turn the flip top. Yeah. You see your lens in there. Sometimes it'll stick to the lid here, but it's good. It's right where it belongs. Pick it up just gently. Good. Okay. Now you're going to want to play it.
It goes like this.
Yeah,
Right?
so the leading, exactly. Put that under the first lip. Yep, you're going perfect.
Look at the light.
Underneath. Okay, and push that one. Push hard. You feel it go under? You feel like a little twist?
Oh, yeah, now we do.
Yeah. Good. So together, now push down.
The
in the
effects is
center,
1.1. Okay.
and then keep pushing down in the center. And you're gonna, with your other hand, lift up these two wings a bit. Okay. Now lift it out of the tray, and then you're gonna have to fill that back one up and over the circle.
That?
Yep. Now close it tight. Good. And get your force out of there. And then roll it in here.
All the way up?
Yeah.
Or just like that?
All the way up. There you go.
Okay.
Okay?
Okay. And don't push it, let me do that part.
Let you do that part?
Push.
To push
Yeah,
the
push.
plunger at the bottom.
Oh, yeah.
So,
Yeah, I
so
usually
the,
put-
the front haptic is caught. You should be the
it
McPherson.
caught?
Yeah, see, see it's
Oh,
tight.
sorry.
Yeah, it's tight. So the front haptic is caught in the thing.
I worry about the trailing one.
Okay.
So that front
there you go.
haptic wasn't up
Okay.
into the
Okay. So it has to be pushed inwards.
push.
And now the trailing haptic is okay.
So close.
Yeah. See when you put it, now you put it in?
Yeah.
Put it in.
Put it in and feel
I want to get the feel of
difference.
normal.
Ah, okay.
See, that's
Yeah.
how it should feel.
Okay.
The other one was
A little bit stiff.
haptic is inside.
Okay.
So now when I look at it, the outside haptic is inside and trailing haptic is inside the thing, so it's good.
Okay. So that's that. He's already pushed IA, so that's ready. And we're done with that, done with that. Ready for the end. And you can take the phaco tip off.
Okay, so
It's just one of those things you develop a knack for it, but it just takes time. Like
For sure.
like nobody comes and gets it right the first time and continues to get it right every time. You know what I mean?
Mhm.
Like it's just
A
the
lot
more-
of steps.
Yeah,
And a lot
the-
of the products look the same.
Yeah. The more you do, the better you'll get at it. That's all. You just need to be in here often.
and I wish they have the expired lenses available for you
Well,
guys to
that's
train
it.
on.
I don't know if you talked to Paul Charette's
I,
place,
uh,
see whether there's.
I have some at the office actually. I can bring it in.
Yeah.
Yeah.
Because she has to put in.
If you go out in the thing there, you might find.
You have to open the stickers on the sheet that they've been opened but not used so they can replace.
Oh, okay.
So she should technically have
Yeah.
some.
But the rep should have some
But the
that
problem is a
we
lot
can
of them
bring.
are folded, pre-folded, right?
Yeah.
So
Yeah,
getting
but
to do
but
that.
even the pre-folded can get it out, and you actually use
yeah,
what's folded. You can do it. You can do that.
Yeah.
Practice on it. Yeah.
So
he's
all
doing
done?
that?
Yeah, all
She
done.
actually just opens the lenses, she doesn't send them back.
Yeah.
She puts the stickers on.
June's the time to go.
So this is the right first eye patient number 15, last one. There's a corneal scar here, big one. We can see a red reflex clearly. Give me some extra freezing, my dear. You're gonna bite a little bit that one. Just bear with me. Try to stay awake. Don't fall asleep. He's snoring.
Yes, the chicken soup works.
Okay, my dear. Stay awake, okay? What did you
Me
give
or
her? Both. Both.
All right.
Okay. She just got 1 milligram of Versed. So try not to leave the cataracts during that area that you don't see very well. So try to arrange it so you start before and to calculate so that you finish it. Even if you don't see it well, you'll know that you completed the Rex as well. So
had her open it early, so then you were on it and after to get it done.
EFX is 1.3. Can put in some antibiotic here, Heather?
Well, it had been vegetables the whole beginning of it, but that's good. So then you're gonna push down the center of it with that and start to put the veins up. I lift the whole lot, I got it straight, and then you want to find that trim. And then you look at the top of it. Like rest it on top. When you're light, you will hold it. You know what I mean? Okay, so not for hold, but like rest it on top. Yeah. And now down here. I think so. So like,
If you want to stay there, that's fine. You can leave
Well,
this
it's okay.
as it is. Yeah.
I'll clean this up.
Yeah. Okay.
Get you organized a little
Yeah,
bit.
yeah.
I feel bad.
It's okay. No.
You've been abandoned.
I don't mind. I'm really very self-sufficient at this stuff.
You all right?
So this is the left
We can get you back.
second eye of patient number 15, the last eye of the day.
Thank you. Thanks.
Okay, we'll give you a little bit of freezing. You need to get a bite a little bit and stay awake. Okay, don't fall asleep.
yeah, just tell him that according to your
A bit of pressure.
Oh, this is squirting from the side here. Oh, maybe not.
Just make sure it's pushed up a bit more.
It's not on all the way, Nicole.
push it up a little further on that paper.
There you go.
Is it good?
Yep, then it'll seal at the top and then. That's right.
Yeah, that's
You did that earlier, you not like, what's that? I said, oh, I don't know.
That's okay, it's good.
Yeah.
Yeah. There's something wrong with it. Failed already.
Now I can
When it says prime complete, you can take it off. Yeah.
I don't know if I can, Bonnie. Really? Yeah. Still in the rest later? I don't know if I can. Why? Did it against your reason? It doesn't feel right. It's like the staffing when we used to do that and I just you didn't what? I didn't think I was here. In the library? Yeah.
Stay awake. Don't sleep. Some when they sleep, they move on for suddenly. So yeah. Yeah.
I'm gonna lose weight this long and it's in roll on. You know what I mean? It's not. EFX is 1.4. It's like counting for carpal tunnel. Why am I counting a syringe?
Because
On a decision this year.
he said you have to count the blade for integrity, not because you can't lose it in the eye, but to make sure the blade.
Who said? Andrew? Yeah, that's what. But I mean, that's your job as a scrub to check the integrity of everything. I mean, that was like before you give it to them and when you get it back.
And I was just like, that was what she said. So.
You have antibiotics.
I do, yeah.
Now I got it. This is going through.
See the tip, Nicole?
Yes.
It's damaged because when you put it in, you shoved it against the shaft of the thing. So see it's bent like that. Do you notice this? There's a little lip here now.
Okay.
See that lip?
Yeah.
When I get it out again, I'll show you what I mean by that.
Another one?
No, it's okay. It's just when you put it in, don't shove it in. If you feel the tip now, feel the tip. Feel it with your finger. You'll find that there's a little ridge at the end of the tip.
Oh.
See,
Okay.
so when you put it in, you shoved it against the thing, so it bends it. Give me IA. Give me the IA.
Yeah.
So you have to lay it on along the thing and then push it in. So, take it out. I'll show you how to put it. Okay. So I'll show you. See. Show me. So if you do it this way, it's going to do that. You do it along the bottom. See along it. If you do this, you're going to hit it. Okay, so you do this, lay it down, and then push it in. Yeah.
Okay, thank you.
Okay. The problem when it's bent like that, sometimes it bothers us to put it through the wound. The wound is just this proper size.
Do you want to take your phaco tip off? You should be done with that.
Very generous.
Yeah.
Yeah. But don't do that because sometimes you come and drop this one. You has to have some. Okay, that's good. Yeah. So what if I drop this syringe on the floor, so you end up with nothing? So don't do that. Yeah. It does happen. All done. You did great. Okay.